It's 2 a.m., the house is quiet, but you're not. Your baby is hot. The thermometer, is it C or F? Which one is better? Which one is right? Is it really a fever? Do you stay or do you go? Here are 3 signs that you should never ignore if your baby has a fever. Let's talk.
Pocketbook Paediatrics.
Hi, and welcome to Pocketbook Pediatrics. I'm Dr. Rishalan, and for some of you, it's welcome back, and for others of you, it's truly hi, and how are you? Whichever side of the camp that you fall on, I am so happy to have you here. Now, we haven't been with each other for some time, so we're going to go back to the basics a bit, and we're going to talk today about fever and 3 signs that you shouldn't ignore if your baby has a fever. And those 3 signs are if your baby is less than 3 months old, if your child is having difficulty breathing, or if your child is lethargic. That means they're droopy, they're not very responsive. But before we go down and talk about the details of why these matter and why we should seek help, let's first set some groundwork because we need to know that baby actually does have a fever. I can't tell you how many times I've actually heard from patients, boy doc, the baby did well hot, or I touched them head and the head was hot, but the body was not hot. And sometimes, to be honest, these changes in temperature that we're picking up, they're really not fevers. They're just the natural change and ebb and flow of how our bodies naturally change our temperature throughout the course of the day. So we need to know what is counted as a fever. So a fever is defined as a temperature of either 38 degrees Celsius, that's 38 C, or 100.4 degrees Fahrenheit, that's 100.4 F. Now, whichever of the types you choose to go with, whether Celsius or Fahrenheit, that's up to you. Most thermometers can change between the two, but as long as you know what you're looking for, that's what matters. Sometimes it can be a little confusing, whether you measure the temperature here or there and whether it's up or down, but this is a good place to start as a baseline. Now, we often get caught up on what the number is and wanting to get that fever down. But the truth is, most of the time, fever is actually helpful. It's a sign that your child's body is working to protect them, a sign to show that the immune system is working and fighting hard. Because most of the times, a fever is caused by some sort of infection. There are other reasons, but majority of the time, we're dealing with an infection. And so a fever is a good sign that your body's child is working for them. So think protection, not harm. So now that we have that under our belt, let's get to those signs and why they matter. So the first one is if your baby is under 3 months old. Now, why this matters is because babies are not really good at letting us know what's really going on. So I say this with a caveat in that if your baby's temperature comes back high and they've been bundled up, we might need to check that again because one of the things that they're not very good at is keeping their temperature controlled. So we tell you to bring the hats and bring the mitts and bring the socks and everything when it's time to bring baby home because we know that they can get cold. But they also aren't very good at cooling down either when they're hot. So if you have baby wrapped up tight and you measure that temperature and you're getting it high, it may not truly be a fever. It may just be that they're a little overheated because they've been bundled up. So, what we need to do is unbundle them, wait 15 to 20 minutes, take that temperature again, and if it really is high, then don't wait, go. Now, why we say that is because another thing they're not very good at is fighting infection. Their bodies just don't have the ability to fight off serious infections because they just haven't been exposed yet. We've been keeping them inside, so they have nothing as a framework for how to fight infection. We also don't have a lot of vaccines on board either to help them. So, because we know these things, when a baby of that age gets a fever, even if they look well, sometimes it can be very serious. And so, this is a reason to go to hospital. The second reason is if your child is not breathing well, and this is across the board, whether it's a teeny beanie or they're getting ready to go to college. If you are not comfortable with their breathing, then it's time to get checked. Now, this can look like they're breathing extra fast or they have very noisy breathing. Sometimes we know what wheezing sounds like. Sometimes it doesn't have to be wheezing, it can just be funny sounds that we're not used to. Sometimes it can be the chest doesn't look right. The ribs are showing more, the chest is pulling in, the nostrils are going out. Those are signs that they're working hard to breathe. So if you see any of these things, or if you are just not comfortable at all with how they're looking, that's a reason to go find help. And then the third reason is if your child is showing signs of being lethargic, they're droopy, they're not easy to wake up, they're not responsive, they're not waking for feeds. These can be signs of either a very serious infection or of dehydration. And sometimes that dehydration can be caused by the illness itself. Sometimes illnesses bring on vomiting and diarrhea, or sometimes the fever itself can be causing your child to get dehydrated. So, because these are signs that something serious might be going on, or your child might need a little extra help staying hydrated because they just can't keep up by themselves, this is a reason to not watch this at home, but get help immediately. So, to recap, those three signs are if your child is less than 3 months old, if you are concerned about their breathing, or if there are signs that your child is droopy and not responsive and maybe possibly dehydrated. So, your pocketbook prescription for today is most of the times fever can be managed perfectly well at home, but there are some times that you do need to get a little extra help. And if there's ever a time that you feel uncomfortable with how your child is looking, it's okay to go and get checked. Now, this is not a comprehensive list of all the things that may need attention when your child has fever, but hopefully it's a good start for you when you need to make a 2 a.m. decision about whether to stay or to go. And with that being said, what has been your most scary or concerning 2 a.m. moment with your child or grandchild or niece or nephew, whoever that special little one is to you in your life? We'd love to hear from you down in our comments below. So thank you so much for watching. Until next time, God bless.
You've got this. We've got you.